Genetic testing is one of the most crucial first steps in terms of being able to set up for preventative care in the future or prophylactic care. So I try to encourage patients to just meet with the genetic counselor, hear what your options are. When it comes to breast cancer or ovarian cancer, we have this unique ability to know if you're at an increased risk. So you can take control over your own health, and it might be scary taking that first step to see your OBGYN, to see a genetic counselor, to speak to your family members about moments in time that weren't such happy memories. But screening and early detection of breast cancer can make the difference between life or death. And if I'm able to be that person to point them into the right direction, then I served my purpose.
Shira, the physician assistant in this video, acknowledges that it can be scary for patients to take that first step and meet their doctor or genetic counselor or talk about their risk for breast cancer or ovarian cancer. And yet, it can ultimately make a difference between life and death for them. Genetic testing is an important tool for helping patients understand their risk of cancer and to take control over their own health. As family physicians, we need to do more to consistently point patients at risk of cancer in the direction of assessment, testing, and counseling. Thank you for joining me for Part B of this two-part lesson on setting up the family practice for hereditary breast cancer risk assessment, testing, and counseling. I'm Dr. Susanna Evans. I'm a family physician and breast cancer survivor and a member of the Family Medicine Education Consortium, or FMEC. These videos are part of the FMEC's Confidence in Hereditary Cancer Discussion Series. The series was created with family physicians in mind, although we welcome anyone to join us in learning more about the importance of helping patients identify their hereditary cancer risk, understand its implications, and take action. This video is Part B of a two-part lesson on how to set up your family practice to assess, test, and counsel patients about the hereditary cancer risk. In Part A, I covered the topics including the importance of screening and testing for hereditary cancer in your family practice, choosing a risk assessment tool, and putting in place protocols and training around the hereditary cancer in order to ensure consistent and quality care for your patients. In this video, I will explain what is a genetic counselor, how do I find and collaborate with genetic counselors, how can I help patients understand their genetic test results, what are the drawbacks and dangers to direct-to-consumer genetic tests, which are popular at this moment? How can narrative medicine catalyze conversations about the risk of hereditary cancer and benefits of genetic testing with patients? Let's get started. Recall that in Part A of this lesson, I talked about steps you should take to put protocols in place in your practice for risk assessment, genetic testing, and counseling referrals. A key element of these protocols should be a list of resources for genetic counseling and testing. Depending on the healthcare system you work in, you may have access to in-house or affiliated genetic counselors, labs, or clinics that can provide genetic testing and counseling services for your patients. If not, you may need to research options available in your community or through the insurance providers who cover your patients. Let me take a step back, though, and first answer the question, what is a genetic counselor? A genetic counselor is a healthcare professional who has specialized training and expertise in medical genetics and counseling. A genetic counselor can help you and your patients by reviewing family and medical records, explaining genetic testing process and options, discuss the benefits, risks, and limitations of genetic testing, obtaining informed consent and ordering the genetic tests, interpreting and communicating the genetic test results, providing psychological support and coping strategies, developing a personal management and prevention plan, coordinating referrals and follow-up care, and providing education and resources for patients and their relatives. For more information, watch the video on best practices for working with genetic counselors that is part of this series. Your practice or your collaborating genetic counselor will need to identify genetic testing providers. When choosing a genetic testing provider, you should consider several factors. These can include the quality, accuracy, validity, and utility of the test, the cost and coverage of the test, the turnaround time and reporting of the results, the ethical, legal, and social implications of the test, and the availability and accessibility of genetic counseling services. You should also consult with your legal and compliance teams to ensure that you follow the relevant regulations and policies regarding genetic testing and counseling. Many government agencies and professional societies offer online directories to help find genetic professionals. Here are 3 examples. The National Society of Genetic Counselors offers a searchable directory of genetic counselors in the United States and Canada. You can search by location, name, area of practice or specialization, and zip code. The American Board of Genetic Counseling provides a searchable directory of certified genetic counselors worldwide. You can search by practice area, name, organization, or location. The American College of Medical Genetics and Genomics has a searchable database of medical genetics clinic services in the United States. Once you've identified genetic testing and counseling resources to refer your patients to, it may seem like your responsibilities end there. However, as a family physician, you will still need to play an important role in helping patients understand genetic test results. So while it is not expected that you have all the answers, you will want to at least have a basic understanding of how to interpret and manage the genetic test results in order to communicate about these with your patient. You may also want to know how to update and align your knowledge and skills to the latest developments and best practices in the field of medical genetics. With this in mind, I'm going to introduce you to some resources available to family physicians involved in genetic testing and counseling for hereditary cancer. The National Human Genome Research Institute offers many healthcare providers genomics education resources. One resource is the Guide to Interpreting Genomic Reports, which is a toolkit developed by the NHGRI and the American College of Medical Genetics and Genomics. The toolkit is designed to help healthcare providers, particularly those who lack specific training in genetics, understand and communicate genomic test results to their patients and their families. The toolkit includes a glossary of genomic terms and concepts, a guide to types and components of genomic reports, a guide to the interpretation and classification of genomic variants, a guide to the actionability and management of genomic results, a guide to ethical, legal, and social issues of genomic testing, and a list of additional resources and references for genomic testing. You can access the toolkit online or order a printed copy of the toolkit from the NHGRI website. Another resource is the CDC's HUGE Navigator. The HUGE Navigator is a continuously updated knowledge base in human genome epidemiology that provides information on population prevalence of genetic variants, genetic disease associations, gene-gene and gene-environment interactions, and evaluation of genetic tests. This database also includes general public health information on specific diseases and health-related topics from the CDC and the National Institutes of Health. If you are interested in exploring additional resources, I recommend you also look into ClinGen, an NIH-funded resource which defines the clinical relevance of genes and variants for use in medicine and research. ClinVar, a public archive of reports about the relationship between specific genetic variants and associated phenotype, and the Genetic Information Non-Discrimination Act, or GINA, a federal law that protects individuals from discrimination based on their genetic information in health insurance and employment. Before we move on, I want to take a few minutes to address the use of direct-to-consumer genetic tests, which have become very popular in recent years. These are genetic tests that are marketed and sold directly to consumers without the involvement of healthcare providers or genetic counselors. They are often advertised as a way to learn about your ancestry, health traits, or relationships, and they usually require a saliva sample or a cheek swab that can be collected at home and mailed to a laboratory. Direct-to-consumer genetic tests have many limitations and risks that you and your patients should understand. Direct-to-consumer genetic tests may not be accurate, reliable, valid, or clinically useful. Companies that provide these tests often tell customers that the results are for information, education, and research purposes only, and they are not meant to diagnose, prevent, or treat any disease or health condition. Results can include potential upsetting information without any context or guidance. For instance, test results can indicate an increased risk of disease when the person's risk is not actually higher than that of the general population. Direct-to-consumer genetic tests do not offer interpretation services or pre-test or post-test genetic counseling or support. Some third-party services have been developed to offer analysis and interpretation of genetic test results, but they may not be regulated, accurate, or secure. Patients may have concerns about their privacy and the confidentiality of their genetic information for tests performed outside the traditional healthcare system. And lastly, specifically related to our topic of hereditary cancers, these tests may not cover all the genes or variants that are relevant. The American Academy of Family Physicians encourages patients to consult with their physicians regarding the safety, use, risk, benefit, and interpretation of direct-to-consumer genetic testing. The AAFP also encourages physicians to be knowledgeable about relevant issues such as privacy, and to inform patients about the limited utility of direct-to-consumer genetic testing in determining risks for future health. Physicians should also discuss the possibility of inconclusive results and offer advice on action steps once the results are obtained. For much of this lesson, I've focused on what we as family medical providers should do to better understand and incorporate risk assessment, testing, and counseling for patients at risk for hereditary cancer. Before we wrap up, though, I'd like to circle back to the relationship between ourselves and our patients. Our ability to establish and expand a dynamic of trust and communication is vital to providing patient-centered and effective care. One of the key challenges many family physicians face in treating patients at risk of hereditary cancer is simply how to start the discussion. Providers, like patients, may struggle in knowing how to bring up the topic. We can overcome this challenge by identifying some strategies to help us initiate discussions about cancer with our patients. This is where narrative medicine can help. The CDC's Bring Your Brave website has some great tools we can use. The site is a rich repository of videos of personal stories from young women and men and their families dealing with cancer. The video, Narrative Medicine as a Tool to Support Patients with Hereditary Cancer Risk, which is part of our FMEC series, goes into depth on how you can integrate Bring Your Brave campaign resources into your practice. However, I want to briefly touch on it here as well. The video, Lisa, My Experience with BRCA Counseling and Testing, is a patient testimonial that illustrates the benefits and challenges of genetic testing for hereditary breast and ovarian cancer. Let's watch a clip from it together.
When I go to the doctor's office, and they always ask your family history of cancers, and so as I'm telling them, how many aunts have had breast cancer, the other cancers in our family, that kind of prompted them to start a conversation with me. She mentioned that there was a genetic test available, and after reviewing my family history, she thought that I might be a good candidate for it. I had sort of heard of the BRCA genetic testing, but I hadn't really researched it well myself. So she gave me an overview, gave me information, talked about why I would be a candidate for it, and then had me think about it. It was overwhelming at first, and then you get past that, and then you realize that sometimes just the unknown is scarier than the known, and you just gotta get through it and get to the point where you have answers, and then you can actually take some action and kind of regain a little bit of control when you don't feel in control a lot of the time.
This is a great video to share with your patients who have questions about what it's like to receive genetic counseling and testing. The video can also help patients recognize that genetic testing can be a tool to help them make informed decisions about their health. You could find this video along with a playlist of additional videos to explore and share on the Bring Your Brave website. Another great CDC resource you can share with patients is the mobile health app, My Family Health Portrait Cancer. Patients can use the app to record their personal family health history. The app will generate a pedigree that can be used for risk assessment and counseling in your patient's conversations with you and other providers. The app also offers educational materials and links to resources for further information and support. Another issue you may encounter when discussing genetic testing with patients is that they may struggle to understand why they need genetic testing, what type of genetic testing they are getting, and what the test may tell them. Patients may also be unfamiliar with many of the terms and concepts you bring up. For example, patients at risk of hereditary breast cancer may be unfamiliar with terms like BRCA and how BRCA gene mutations may or may not lead to cancer. The CDC offers resources you can share with patients to help them understand and take action. Introduce your patients to the CDC's genetic testing webpage, which provides information and guidance on genetic testing and its implications for health and disease. It includes a definition and explanations of genetic testing, the reasons for having genetic tests, and the types and purposes of such tests. The CDC's BRCA gene mutations webpage is another helpful resource to put in front of patients. It provides information and guidance on hereditary breast and ovarian cancer and BRCA gene mutations. The webpage includes information on why BRCA gene mutations matter, information on groups that are at higher risk for BRCA gene mutations, guidance about direct-to-consumer genetic testing, as well as links to the Bring Your Brave resources. We've covered a lot of information in this lesson on setting up your family practice for hereditary cancer risk assessment, testing, and counseling. Let's review the highlights. This video covered what a genetic counselor is, how to find and collaborate with genetic counselors, how to help patients understand genetic test results, the drawback and dangers of direct-to-consumer genetic testing, and how you can use narrative medicine to catalyze conversations about cancer and to support and empower patients who are at higher risk. I hope that you have found this information useful and that you're taking away some concrete ideas for how you could apply these ideas to your practice. Thank you for joining the Family Medicine Education Consortium to learn about risk assessment, testing, and counseling for hereditary cancer. And be sure to check out our additional videos that are part of the Confidence in Hereditary Cancer discussion series.